Dear Mr. Cayetano, dear colleagues, on behalf of the Ministry of and Social Protection of the Russian Federation, I would like to welcome you to the Global Forum. This event, in the current situation, is especially important. The world is going through a difficult time, and the reason for that is a pandemic of a new coronavirus infection which can only be tackled by joint efforts of the international community. In this regard, I would like to briefly talk about the measures that have been taken by Russia to combat the consequences of the pandemic, and then go directly to insurance against industrial accidents and occupational diseases. To combat the consequences of the pandemic, the Russian government allocated significant funds and took a number of measures to minimize the risk of infection among its citizens. The days from the 30th of March to May 11 were declared non-working paid days. During non-working days, only medical organizations, social institutions, and also organizations of a continuous cycle carried on operations, providing the population with essential products, housing and communal services, transport links and communications. But in such organizations, the most vulnerable workers, citizens who have reached the age of 65 and older, were singled out separately. Even if the enterprise continued to operate during non-working days, a state allowance for temporary disability for the period of self-isolation was introduced for all the employees. It was issued exclusively remotely, according to the information provided by employers via electronic communication channels. In total, during the pandemic, more than 4.3 million sick leaves were issued remotely. We transferred most of the procedures for interaction with the state online. Many support measures were prescribed and extended without recourse from citizens. In the period from March the 1st to October the 1st, in order to minimize social contact of citizens, certificates on the degree of loss of professional ability to work were drawn up and issued without a personal visit to the Medical and Social Expertise Bureau. In the period from March the 1st to October the 1st, in order to minimize social contact of citizens, certificates on the degree of loss of professional ability to work were drawn up and issued without a personal visit to the Medical and Social Expertise Bureau. The victims' rehabilitation programs were adopted in a similar way. Temporary order has also been provided for the automatic extension of the previously established percent of occupational disability for 6 months for those citizens whose terms require a re-examination in this period. The pandemic has also impacted policies regarding the prevention of occupational accidents and diseases. The government has provided an opportunity for those enterprises that have continued to work to use the premium funds for testing coronavirus infection and for personal protective equipment. Now I would like to say a few words about the prevention of industrial accidents. At present, there is a need to modernize the social insurance against occupational accidents and diseases by reorienting it to the reimbursement of costs associated with the insurance coverage on the prevention of occupational accidents and occupational diseases. One of the preventive methods can be the temporal withdrawal of an employee with early exposure to harmful occupational factors, the so-called protection by time, and the implementation of treatment during this period aimed at preventing the development of occupational disease, followed by constant monitoring of the employee's health. In order to determine the risk of an occupational disease, timely take measures to treat and improve the health of an employee or hazardous industries, and if necessary, withdrawal from harmful working conditions, it is advisable, along with monitoring the state of health, to monitor the occupational route of an employee, taking into account his age and work experience with harmful and hazardous production factors. In order to determine the risk of an occupational disease, timely take measures to treat and improve the health of an employee, and, if necessary, withdraw from harmful working conditions, it is advisable, along with the monitoring of state of health, to monitor the occupational route of an employee, taking into account his age and work experience with harmful and hazardous production factors. Such monitoring can be included in the occupational risk management system as an effective tool that can reduce occupational illness. And in conclusion, I would like to emphasize that the variety of challenges faced by the social and labor sphere on a daily basis dictates the need for cooperation and exchange of the most advanced expertise. I am confident that our joint work will contribute to more effective. Thank you for your attention.
Mr. Prudov, thank you very much for your comments. In the current environment, it's quite fitting. I'd like to, switch over to another keynote speaker that we have for our opening remarks today, Mr. Alexei Polikashin, the deputy chairperson for our host. the social insurance fund of the Russian Federation. Mr. Prigozhin.
Good day to everyone, my dear colleagues. Allow me, on behalf of the organizer of this forum, the Social Insurance Fund of the Russian Federation, to welcome you all to the first virtual global forum on work injury insurance. First of all, let me thank the organizers of the World Congress, ILO, ESA, esteemed Canadian colleagues, our colleagues of the ESA Technical Committee, which is the Secretariat of the Global Forum, for trusting us to become the organizers this year. In February, I attended one of the last face-to-face events held by ESA in Malaysia, where I met many of the speakers present here at the technical seminar Digital Technologies, New Forms of Employment. It was a wonderful event, which was organized at the highest level by our colleagues from Malaysia. We touched upon the issues of job cuts in the traditional sector of the economy, the obsolescence of education, the crisis of solidarity in the social security system. We discussed the development and the use of digital technologies, topics related to security and protection of data. At that time, we saw these challenges as a question of a distant perspective of 3, 5, or even 10 years. Any crisis means, first of all, new opportunities. The coronavirus had brought personal tragedy to the lives of many people, but at the same time, it has contributed to the acceleration of the development of society. The projects that we talked about theoretically in February had to be put into practice in March, and in April they reached full capacity. This concerns the digital transformation of the provision of services, the prevention of industrial accidents and occupational diseases, the sustainability of insurance funds. We had to react to all these challenges very quickly. Leading experts and researchers have gathered today to discuss the social implications of the coronavirus, share experiences and work out joint solutions. Every country, every region has its own experience. We will talk about it today. First of all, the issue of international coordination of measures against coronavirus has become very acute. We are much more connected than we used to think, so we need to work together. Secondly, the ways we communicate with employees, employers, and insured persons have changed. The third important issue that we will discuss today is the expansion of the use of new technologies. Our speakers will focus on the problem of developing uniform standards for prevention and labor safety. And finally, let's talk about the problem of stability of insurance funds, maintenance and preservation of insurance reserves. These are the areas that have been affected by the coronavirus. As we can see, the pandemic has raised tough issues for us related to workplace safety, constructive dialogue with employers, payment of benefits, and support for victims in the workplace. Now let me say a few words about what we faced in Russia. According to the official statistics, industrial production decreased by 3.5% in the first half of 2020 compared to the same period last year, and the number of accidents and occupational diseases decreased by 11%. This was a consequence of the impact of the pandemic on the development of the economy and the reduction in production in so-called high-risk industries. There are about 5 million policyholders with our fund, and we see that in an effort to reduce costs associated with the pandemic, many companies are using various tools to support economic activity. For example, a new work schedule is introduced in the office, in particular shifts of home and work office, a week after week. Some organizations have transferred to remote work up to 80 or 90% of the employees, which, by the way, for the employees themselves, raises the questions of correct organization of workplace at home. You need a good communication channel for video conferencing, a convenient place at the computer, compliance with the regime. There's a massive, literally explosive spread of the use of video conferencing and instant messages to communicate with your colleagues. Actually, this event confirms this approach. These factors are reflected in the so-called ergonomics of work because employees work in new conditions for themselves and need the care of both employers and social welfare authorities. I would like to note that, starting this summer, our policyholders can purchase testing services for COVID-19 as well as personal protective equipment at the expense of the fund. The fund itself, as an employer, also ensures the safety of its employees in the workplace. Thus, the coronavirus outbreak set new tasks for us. The state needed to react very quickly, identifying the sources of financing, bringing payments to the recipients. We have managed to resolve issues with health care financing, but experience shows that the problem is much deeper. Often it is in the medical institution that a disease focus occurs. Why does it happen? We do not have yet an answer to this question. Thirdly, the special assessment of labor protection conditions that we carry out at enterprises is outdated and requires revision. We saw that the state had to introduce unprecedented measures to restrict the movement of citizens. Special measures were taken to protect the most vulnerable social groups, elderly citizens and people with chronic diseases. However, not all these issues have been resolved. Some have been fully worked out, others only in part or require further development of approaches. At the same time, we as a fund faced a number of challenges. In a short time, payments were organized to citizens entering the country from abroad and getting into quarantine for 2 weeks. The fund provided payment for sick leave for sick and people in quarantine, including for working citizens 65 plus and older. We have provided medical workers with additional insurance guarantees in the framework of insurance against industrial accidents and occupational diseases. Comprehensive work was carried out, amendments were made to the legislation, and procedures for assigning payments were developed, and much more. Comprehensive work was carried out, amendments were made to the legislation, and procedures for assigning payments were developed, and much more. It turned out that it is necessary to revise the approaches to the insurance coverage of employers working remotely. In Russia, measures have been taken to directly support healthcare workers fighting COVID-19. These are, first of all, additional payments in case of illness or death of a health worker. In Russia, measures have been taken to directly support healthcare workers fighting COVID-19. These are, first of all, additional payments in case of illness or death of a health worker. Since it is necessary to constantly check the information, we use various sources for information, including the media, the internet, social networks. We promptly created a personal account on our website for medical workers affected by coronavirus infection and their relatives. Personal managers were appointed to accompany healthcare workers in case of COVID infection. In addition, liaison was ensured with commercial banks for the use of special banking products by beneficiaries. Despite the fact the issues of digitalization, teleworking, and the payment of benefits are certainly extremely important, it should not be forgotten that the pandemic has affected the basic areas of global economic activity, mining, electricity generation, nuclear energy, and many others, where the pandemic could cause significant damage and lead to serious consequences. So far, we have managed to stop the pandemic on the distant lines, but we need to be vigilant. Let me quote the famous American diplomat Henry Kissinger. When the COVID-19 pandemic ends, the institutions in many countries will be perceived as having failed. The reality is that the world will never be the same after coronavirus, he said in early April. But we do not agree with this. In order to increase the credibility of our work, accident insurance organizations from all over the world have gathered here today. In order to increase the credibility of our work, accident insurance organizations from all over the world have gathered here today online, and we will try to provide a coordinated response. In our opinion, there is a recipe for coronavirus, and it should be provided by key international organizations. The World Health Organization, which is responsible for public health throughout the world, the International Labour Organization, responsible for decent and safe work for people, and the International Social Security Association, as an institution of social welfare funding organizations. Our fund undertakes to collect all the theses and proposals that will be heard today and send them to ESA for inclusion in the current guidelines so that we, together with you, can respond to any challenges and threats. Let me once again thank the organizers of the event for the opportunity to gather at this platform and discuss current problems. Good luck to all of our speakers.